You might wonder that what has urban planning or land use planning to do with health and well-being? Well, you already heard that my background as a professor of land use planning is a bit unusual. So maybe you can understand my personal interest towards the kind of human aspects to planning and design. So health would be a very natural choice for me. There is also a more general interest. Bournet wrote already some 10 years ago that planning and health is big news. This had to do a lot with paradigm change in environmental health research. The traditional environmental health research focused on illness-producing characteristics of environment, like pollution, etc. But this first wave environmental health research was complemented with a second wave environmental health research paradigm that was focusing more on the health promotive aspects of and characteristics of environment. And that paradigm change brought urban planners very much to the scene. This shift was naturally also related to our current public health issues, which are very much related to things like inactive lifestyle, obesity and overweight, or stress-related illnesses. So you can understand that these kind of challenges has to be addressed in a very multi-perspective manner, and lifestyle is something that urban planning maybe can have an effect on. Well, now there is already an abundance of research concerning these health promotive aspects of a living environment. And I would summarize the findings to two basic categories. First, there is research concerning environments that promote active lifestyles, active living research. And maybe the main finding there is that rather dense urban structure promote active lifestyle. But then there is another branch of literature which talks more about mental health and the kind of settings that restore us from stress and fatigue. And there the main answer would be different, like green environment promotes stress restoration. But think about an urban planner who looks at these literatures. They can be quite confused. You can, depending on which literature you look at, you get almost opposite answers to your questions that what kind of urban structure actually promote health. And what is also sad is that those two literatures don't speak with each other very much. They work quite separately, unfortunately. Well, in my team, just like Kauko already mentioned, we have developed a very special research approach to study these kind of themes, among others. Already some 10 or 15 years ago, I started to dream about a new kind of methodology that would allow us to look at human behavior and experiences place-based, so that we can connect behavioral patterns and experiences to actual physical settings, give addresses to our experiences. So I was thinking that this way we would be able to collect a whole new layer of knowledge on top of traditional layers of geographic information systems that I would call here hard knowledge layers. So this soft information would complement that. We have done, actually I was thinking that if we could do this, we could reach two important steps both in research and in participatory planning. In research, this methodology might be able to allow us to do a new kind of transactional person-environment research, and maybe we can also find a new tool for participatory planning. Well, my dream has really came to step by step, and currently the innovation of ours, soft GIS, or we call it nowadays to public participation GIS, has been commercialized, and a tool, sort of like a SurveyMonkey with a mapping element, allows you to build and manage a survey of your own without any coding skills. You can collect quite large data sets online. You can also analyze your data sets, visualize and communicate without specific GIS program skills. And we have used this methodology to study a number of themes, like I will tell you soon. But here is one first application that was used in Tokyo to study children's environment in that kind of urban setting. Also, indoor setting has been studied here in Otaniemi campus using this same methodology. Here is a case, cultural heritage case from Norway, and here a case from Santa Monica, if I remember correctly, from US. No, this was one Santa Monica, that was San Jose, the previous one. And here is from Stockholm, New Zealand, and Jyväskylä, Denver, and finally New York. Transportation unit has lately used our tool. There are some 500 cases already here in Finland and abroad using this methodology. And as I said, we have used this methodology to study a number of themes and various user groups, as well as use this in real-life planning cases in different planning phases, scales, and in relation to different approaches. And active living research has been one of the themes among many others that we have studied. Let me show you a few examples. One project that was realized a few years ago here in Helsinki and Espoo cities addressed a very topical theme in urban planning, namely urban densification policy or intensification policy. You might know that these urban densification projects tend to be quite socially conflicting cases. Often the acceptability of those densification projects or urban infill projects are problematic. So we wanted to study this theme by using the online tool we have developed in 11 different neighborhoods in Espoo and Helsinki. Both city center settings and also more suburban settings. And people were asked to map, in this case, different kind of positive and negative experiences in about urban perceived environmental quality, the appearance, social life, atmosphere, and functional possibilities of the environment. But we were very interested in to find out how is urban density related to perceived environmental quality. And in this project we found a very intriguing curvilinear association or relationship between the two variables, which was contrary what we expected, because in earlier studies they had found, and we also found, a linear association. This curvilinearity would mean that there you can find a level of urban density where urban perceived environmental quality peaks. And in this case it was rather high level of urban density. We did study also perceived health in this project, by using a more sophisticated statistical analysis, but we didn't find direct associations between urban structural characteristics and health. Although we were thinking we are doing very individually sensitive and sophisticated way to study urban structure, because we knew each person's home, and we buffered home with a 500-meter buffer zone so that we could see the exact level of urban density or green structure around that person's home. So we don't treat, for example, inhabitants of Töölö all equal, like the same, regardless the person lives along Mannerheimintie or by the sea. We also buffered the important places the person had marked. In this project, Urban Happiness Project, one part of the answer was, if you understood the message, that urban density is not always perceived very negatively, at least if it doesn't exceed a certain level. But the same project revealed us that green places are extremely valuable experientially. We looked at the proportion of green structure around positive and negative places, and we found that positive places were clearly more green than negative one, except for one exception. Socially positive places were clearly less green and more densely built, quite logically. So at the same time, rather high density and very green environment might promote or bring about best results. But what is wrong about our elegant way to look at this urban structural characteristics? I'm not allowed to ask you anything here, so I answer myself that well, why did we decide to use 500-meter buffer zone? Wouldn't it be more relevant to look at individual activity spaces or home zones more dynamically? For in this case, the even more individually sensitive way to look would be something like this. So at the moment we are trying to take steps from static buffer zone definition to a more dynamic one, dynamic individually specific activity space in the PhD project by Kamiar Hasan-Zadeh. And we have used this way to look at the activity spaces of older adults, aging population, and we have in a PhD project of Tiina Laatikainen, and we have found that certain urban structural characteristics are associated with active mobility patterns in everyday life of older adults. And again here, urban density measures are associated with active everyday life. And these findings are very much in line with a recent study by Jim Salis and colleagues that was published in Lancet. Also he found that urban density and intersection density, and also in his case, number of parks promoted active mobility in an active physical activity of people from all these countries and continents. We are taking still another step to look at these individual activity spaces dynamically, namely now we are looking at the dynamic fabric of the individual activity space. We are trying to take even further steps in defining what is the environment actually we are exposed to in our daily life. So we are believing that this way we can predict even much better the characteristics that promote health and well-being of people of different ages. Kamjar has also made some kind of typology of various types of activity space, namely monocentric, bicentric, and polycentric, and he has found that among the aging population, the majority of people are living monocentric life, meaning that their important places are concentrated strongly around their home. And he has also found that there are some preliminary findings that polycentric activity spaces are where the travel modes are least active. But if you look at polycentricity and well-being, you find that polycentric activity spaces are positively associated with quality of life, but monocentric instead are associated with higher perceived well-being. Let me finally look at a little bit the other side of the coin, how this kind of methodology has been used in real-life urban planning cases. And here my main case is Helsinki Master Plan, an ongoing huge effort. We have identified some knots and some problems, issues in participatory planning in Finland, and we are arguing that this online methodology can at least partly address some of these issues. For example, that not only a handful of people would participate, but larger groups of people. In Helsinki, this methodology we have developed was used as one methodology among others in participatory planning master plan process. And a nice data set was collected from nearly 4,000 respondents and who made nearly 33,000 markings on the map. In this case, the representativeness of the respondent group wasn't quite ideal, although the overrepresentation of younger generations, some said, balances the situation that with more traditional participatory planning techniques you typically reach older population. In this case, people were asked to only two things: where to build new infill in Helsinki area, where not, where are the green areas that should be protected. Because the master plan proposal was published for the first time ever in a grid cell manner, we were able to look at how the view expressed by inhabitants in this online survey, to what degree does it align the master plan proposal. We did some kind of compatibility analysis, and we found that the result was something like this, that the important green areas that inhabitants were marking on the map as worth protecting, 25% of them were within the plan area, meaning that they are threatened by the master plan proposal. I'm not sure if that is a high number or acceptable percentage. Further discussion surely was needed and was carried out in this case. But this gave an overall picture of the match or mismatch. If you look at more carefully the data set that was collected, here are all the markings concerning new building sites. you can perhaps also see if there is any support for one of the key ideas in Helsinki Master Plan, namely the idea of urban boulevards. Well, you can see that there are quite a few markings for new building sites along those motorways to the city center Helsinki, where the urban boulevards that look like this could be built. I'm asking too that when these urban boulevards were discussed in media during the master plan process, health issues were very much taken up. But mainly it was about air quality or noise, so those traditional direct health issues. And some commented also the access to green areas. But very few people mentioned anything about active living. I think if you look at health, you should always see the full picture. And actually there are some studies already done who look at the joint effects of these different kind of health impacts. And this study, for example, was showing that active living actually the benefits related to active living compensate in a multifold manner the air quality issues on a busy street, which was quite interesting. One more example from city of Lahti that has been developing a beautiful way to integrate the opinions of people to their actual planning practices and trying to guarantee that the data, the knowledge collected from people are really in use. City of Lahti tries to promote child-friendly city, that is in their strategy. And what was quite interesting was that the city was collecting a nice data set from 59 daycare centers who marked on the map the areas daycare centers use for environmental education. In this city, once forest sector had accidentally cut one of those important forests used by children and young people, and the local urban planner wanted to avoid these kind of situations ever happened again. Therefore, they collected this data set, integrated this as a special soft knowledge layer to their GIS system, and now it is part of the knowledge base as along with all the other knowledge used in urban planning. When the local architect was thinking about this small block, she noticed that children are using this crosscut through the block to reach those natural areas that they use instead of using this busy road here. So she wanted in her plan guarantee that this will be possible also in the future by marking it on her plan. So let me conclude that I think it shouldn't be impossible to plan for both green and dense enough city in the future for individual health and well-being, but also for ecological health. So this kind of win-win situation, I think, should be possible. So my task has been to build bridge between the everyday life of the users of various spaces and then the planning practice. And I hope this bridge building will continue in new ways in the future. Thank you.